Let me ask you something. Have you ever seen Botox ads saying things like $10 per unit or $99 per area and wondered, how many units of Botox do I actually need? Because here's the truth, most people don't realize there isn't one number that works for everyone. And choosing Botox based only on price can sometimes lead to results that either look too frozen or wear off too quickly. So let's talk about how Botox is actually calculated. One of the most common questions people ask is, how many units of Botox do I need? And the honest answer is, it depends on your face, not your age. Botox isn't a one-size-fits-all treatment. It's carefully dosed based on three important things: muscle strength, facial movement, and your natural facial anatomy. Every person's face moves differently, which means the number of units needed can vary a lot from one person to another. For example, some people have very strong frown muscles between the eyebrows. Those are the muscles responsible for the lines that appear when you concentrate or frown, sometimes called the 11 lines. If those muscles are stronger, they may need more units to properly relax the area and smooth the lines. But someone with lighter muscle movement might only need a small amount to achieve a soft, natural-looking result. So two people with the same wrinkle could require completely different dosing. Another factor many people don't realize is muscle size. For instance, men often require more units than women simply because facial muscles are typically larger and stronger. That means they may need a slightly higher dose to achieve the same relaxing effect. But even beyond muscle strength, there's another important factor: facial balance. A skilled injector isn't just looking at a single wrinkle, they're looking at how your entire face moves together. For example, treating the forehead affects how the eyebrows sit. Treating the frown lines can influence overall facial expression. So instead of focusing on just one line or one area, a good injector considers the harmony of the entire face. This is also why buying Botox purely based on per area pricing can sometimes be misleading, because an area doesn't actually tell you how strong the muscle is. One person's forehead might need 8 units, while another person's forehead might need 20 units, even though it's technically the same area. That's why experienced injectors don't aim to use more Botox. They aim to use the right amount. The goal is always to keep your face natural, balanced, and expressive. Good Botox shouldn't make people say, "You had Botox." Instead, they should say things like, "You look refreshed," or "Did you do something different?" Because the best results are subtle. They soften wrinkles while still allowing your face to move naturally. This is why the consultation is such an important step. During a consultation, a provider evaluates your facial movement, muscle strength, symmetry, and aesthetic goals. Only after that assessment can the right number of units be determined, not before. So if you've been thinking about Botox and wondering how many units you might need, the best place to start isn't guessing the number. It's starting with a professional consultation where your face can be properly evaluated. Because when Botox is done correctly, the goal isn't to change how you look. It's simply to help you look like yourself, just more refreshed. And remember, the right amount of Botox isn't about using more. It's about using exactly what your face needs.